Hello. Hi, everyone. Can you hear me? Can you hear and see me? Okay, don't be shy. Please start chatting in our chat box. Hello. Hi, Ivona. Hi, Aisha. Can you hear me, guys? Hi, Jagmara. Okay, great, Mihao. Thank you so much. Hi, Christoph, Timmy. All right. Okay, so I guess everyone can hear and see me clearly, right? Okay, so everyone, good day. Welcome to our Tutlo webinar series entitled Help, We Need a Doctor? First Aid in English. Today we are going to talk about a very significant subject. So first aid, specifically about CPR. So later you will learn what CPR stands for, okay? So this webinar will only take 30 minutes of your time. It has got 3 parts. First is the discussion. Second is a quiz. Don't worry, it's very easy. And third, okay, so please do me a favor. I'll let you answer some short poll questions, only 2 of them, okay? And thank you for joining us here and taking some time to learn skills necessary to save someone's life. So, and I hope you can stay tuned until the end of this webinar. Okay, so, okay. So I'm Princess Marce, one of the tutors here at Tutlo. I've been teaching English for more than 7 years now, 2 years here with Tutlo. And aside from that, I was also an emergency room nurse before, and I have tutored about different nursing subjects to students of nursing. All right, so are you guys ready? Oh, hi, Anna. I'm sorry about that. Maybe you can refresh your page or use a headset, okay? All right, so let's continue. All right, so wait, please. Okay, guys, to begin this webinar, I'd like to introduce you to Ella, the kid in the first picture. She is a cardiac arrest survivor. And Deb, okay, the woman below Ella's picture, okay? So she is Ella's lifesaver. So let me tell you about their story. All right, so one Friday morning in September 2011, Ella was walking to her class and her heart started racing in the hallway. So she walked into the class, got dizzy, she fell, and everything just went black. So Deb, the elementary school principal, okay, so Deb is the person below Ella, okay, as you can see that in my presentation. Okay, so she has done a lot of CPR trainings, okay, and she started CPR on Ella right away after they had found out that she was pulseless. To cut the long story short, Ella survived and grew up a beautiful and young lady. Okay, so let me show you another picture, guys. All right, so this is Ella now. So just imagine if it would have happened in another place without somebody who knew CPR. Ella wouldn't have made it. And the fact that Deb, the school principal, knew it and was courageous enough to perform it is the reason that Ella's fine today and alive today. So guys, are you ready? Or to say, you don't need to be a part of Avengers or X-Men team just to save lives. All right, so just knowing the right way how to perform this CPR and great courage will. So are you guys ready to acquire this special superpower Tutlo is going to impart to you? Are you ready to have a superpower? Don't be shy. Start chatting. Of course. Okay, great. Yes. All right. Okay, so you guys are already great. So let's get started. Mm-hmm. Okay. So during my introduction, you guys have encountered 3 important terms. Okay, so, and we will encounter them for the rest of this webinar. So it's very important for you to know their definitions. Okay, so number 1, okay, repeat after me, even though I cannot hear you guys. Okay, so the first one is cardiac arrest. Your turn. Cardiac arrest. Okay, good job. All right, so cardiac arrest is a sudden, sometimes temporary, stopping of function of the heart. Stopping of function of the heart. Okay? So I'm gonna write that in the chat box. Okay, so number 2. Remember this, guys, because later I'm going to ask you. Okay? So pay attention. So CPR, short for cardiopulmonary resuscitation. So CPR, cardiopulmonary resuscitation. Okay, so remember these 3 important points. Okay, so cardio pertains to the heart. Okay, heart. Pulmonary pertains to our lungs, the organ that we use to breathe. Okay, and resuscitation means to recover. One more time, resuscitation means to recover. And we have number 3, pulseless. So pulse, okay, so we can feel it right here, and less. So it means having no pulsation, no pulse, or lifeless. Okay, I'm going to type that in the chat box again. So again, we have cardiac arrest, CPR, pulseless. So please remember the definitions of these 3 important vocabulary. All right, so now, okay, wow. So how is this animal feeling? How is it feeling? What do you think, guys? Is it happy? Is it afraid? Start chatting. Don't be shy. Happy? Oh, scared. Yes, afraid. Ivona, yes, very good. Scared. All right. Okay, let's say scared. Frightened. Very good, Michael. Meow, sorry. Meow. Frightened. Okay, yes. Very good, guys. You guys are all correct. So many people are afraid of performing CPR for a variety of reasons. So guys, may I know your fears about performing CPR? Why are you afraid of performing CPR? When I was, younger, when I, haven't studied this CPR thing, I was really afraid about doing it not correctly. Okay, how about you guys? What are your fears? So, Gregory, I think you are worried. Lack of competence. Okay, not to make things even worse. Yes, okay, so of course we are afraid to make things even worse. Okay, Edita is shocked. Yes, sometimes you just freeze, right? Okay, well, anyway, let me tell you about the common fears people experience when they are in that kind of situation. Okay, so of course, number one actually is the fear of disease. Some are afraid of getting disease from performing mouth to mouth when giving rescue breaths. All right. So, although the chances of getting a disease from this aren't very high, there are barrier devices available, such as the pocket masks. So, that's on the left, and the bag valve masks. So, that's on the right side. So, again, the pocket masks and the bag valve mask. So, remember those things because I'm going to ask you those questions again later. All right. So maybe I need to type them. Sorry. Pocket mask on the left. And number two is the bag valve mask. Yes, that's right, Edita. Okay. All right. So now, okay, but if the victim is an adult or teen, you may actually consider compression only CPR. So when you say compression, yeah, you just have to pump on the chest. Okay, and of course it's necessary to give rescue breaths, but if you are really afraid of doing it because you're afraid you might get a disease, you may continue with compressions, and later on we're going to talk about more details. Okay, so now let's move on. So another common fear is a fear that will be held liable if the victim does not end up making it. So just like one of you said earlier, okay, so you're afraid that you might, make things worse, right? So fret not or worry not because there's the Good Samaritan Act or laws. So Good Samaritan laws generally provide basic legal protection for those who assist a person who is injured or in danger. So there's no need to worry about. All right, guys? Okay, so let's move on. Okay, so yeah, one of you also said that, okay, they lack competence, right? So here, okay, another fear is, other people are unsure of their skills. Just like this person, yeah, bro, I don't know what to do. Okay, so this is serious, guys. I want you to realize that when a person is in cardiac arrest, they're dying, and what you can do is help them. You can only help them. So you might break one of their ribs, the ribs, okay, the bones here, okay, that protect our lungs from compressing to the, it's possible, okay? But at least you're giving them a chance to survive. So studies show that immediate CPR can double or triple a victim's chance of survival. Okay, so now let's move on to the next one. Okay, so here, these are the things that we can do when we are in that kind of situation, emergency situation. All right. So the American Heart Association and Emergency Care, Cardiac Care, have come out with this out of hospital chain of survival. So thanks to them. Okay, first, okay, as you can see, yeah, remember these 5 stages. All right. Okay, so first, we have to recognize cardiac arrest. We have to know if the person or the victim is experiencing cardiac arrest. Okay, and activate emergency response system by calling 911. All right? Okay, I think in Poland you have another emergency number. Who knows the emergency number in Poland? Can you type that down in the chat box? 112. Thank you so much, Adita. Okay, so in Poland, you have to call 112. After that, immediately perform second stage. We're now on the second stage, okay? So after that, immediately perform CPR with the emphasis on cardiac compressions. Compressions, okay, compressions mean to pump, okay, the mid-chest of the victim. Later on, I'll teach you how to do it. Okay, when AED is available. Okay, I will type that down. AED. When AED is available, it should be used properly on the victim. So okay, so that's stage 3, all right? So stage 4, basic and advanced emergency medical services. So when further help arrives, they will perform effective advanced cardiac life support. And stage 5, give integrated post-cardiac arrest care. So for stage 4 and 5, okay, so of course the professionals or the healthcare professionals will take care of the victim already when they arrive. Okay, so now let's move on. Okay, so we have encountered 2 important terminologies again, but we have already discussed what CPR is earlier, right? So let's review about CPR. I hope you can still remember. I told you to remember. Could anyone tell me what CPR stands for? Okay, what does CPR stand for? Do you remember, guys? Don't be shy, start chatting. Cardiopulmonary resuscitation. Perfect, Marek. Okay. Yeah, great job, Yulia. Hi, Adita. Yes, you got it right too. Okay, very good. Okay, different spellings. Okay, but for the correct spelling, guys, you can look at Marek and Yulia's answers. Okay, and also Arthur's. Yes. Okay, so thank you so much. All right, so now we're moving on. Great job. So what does cardio refer to? Cardio. Cardio. What does cardio mean, guys? I'm giving you a clue. Sorry. I'm waiting. Oh, there you are. Okay. Heart. Very good. Okay, Mariola. Wow. Okay. Heart. Very good, guys. Okay, how about pulmonary? What does it mean? Pulmonary. Anyone? Lungs. Great job, Ivona. Okay, and how about resuscitation? Resuscitation. Okay. All right. Recovery. Well, that's good. Okay, so resuscitate means to recover. And yeah, resuscitation means recovery. Great job, guys. Nicola, Anita. All right, great job. Okay, so thank you everyone for your participation. You did a great job. Now, we have another terminology, AED. I mentioned this earlier. Does anyone know what AED stand for? I think I saw someone earlier who typed the meaning of AED, but I cannot see it anymore. So if you guys know, just type them in the chat box. Automated external defibrillator. Wow. Good job, Marek. Good job, Aisha. Okay, so yes, you're right about that. Okay, automated external defibrillator. Yes, Adita, it's a defibrillator. Good job. All right, so let me show you a picture of an AED. Wait, please. Oh, there you are. Okay, so this is a dummy connected to an AED. So it is a device that automatically analyzes the heart rhythm. Okay, the heart rhythm, and that if it detects a problem, it automatically gives shock to restore a normal heart rhythm. It gives shock to restore a normal heart rhythm. Okay, heart rhythm. So because they are small and easy to use, they have been installed in many settings. I'm sure you've seen this in schools, airports, or even in the gyms. They have this. It's very important. And it actually increased the number of opportunities to save lives. So it is very easy to use. Baby Annie. Who's Baby Annie? All right. Okay, well, anyway, let me tell you how to use a defibrillator. Okay? So remember this, guys. Number one, of course, we have to turn it on. Turn on. Remember, number two, place the pads on the chest according to pictures. So as you can see, it has pads, the white ones, and you have to place them according to the pictures. Connected to the AED. Okay? And the third one, you have to follow the voice prompts. You have to follow the voice prompts. Number one, turn it on. Two, place pads on chest according to pictures. And three, follow the voice prompts. Okay, so let's review how to use the AED again. So, number one, what is number one? What to do first? Number one. Turn on. Okay, turn on. Try on. Okay, it's turn on. Very good, guys. Doing great. Number two. What is the second step? How to use the AED. Okay. So yeah, we're done with turn on, number one. Number two, place something on the chest. Place the pads on the chest. Place pads on body according to the picture. Yes. Okay, great job. So place the pads on the chest according to the pictures. Okay? Very good, guys. Number three. We are now on number three. Number three. Follow the voice. That's right. Follow the voice prompts. Okay, so yeah, that's how we use the AED. All right, follow the voice. Okay, great. So number one, turn it on. So number two, place pads on chest according to pictures. And number three, follow the voice prompts. Okay, great. So let's go back, guys. Okay, I think it's Andre, okay, who typed something about calling other people. Yes, okay, we're going to do that later, okay? So let's go back to our chain of survival. So what's the first step again? Does anyone remember? So, yeah, okay, so does anyone remember about our chain of survival stages? Number one, okay, according to these pictures, what should we do? So, call for help. 112, great. Okay, that's right. So, of course, recognition of cardiac arrest first, and activation of emergency response system. So, how do we recognize cardiac arrest? So, how are we going to know the person is having a cardiac arrest? So, we have to check consciousness by shouting the victim's name. Like, for example, if the victim's name is Victor, let's say Victor. Okay, Victor, hey, are you okay? So you have to gently tap or shake the victim's shoulder, just like what you see in picture number one. Tap or shake the victim's shoulder, and then say, hey, are you okay? So if not responsive, Yes, that's right. Talk to him. Are you all right? Okay, great. So if not responsive or breathing abnormally, what do we do next? Okay, if the person is not responsive, what do we do next? Call, okay, call 112 in Poland, all right? Okay, so call 112. So how do we assess breathing? Look at the third picture. Okay, open the airway. How? Okay, with the person lying on his or her back, tilt the head back slightly to lift the chin of the victim. Okay, and then listen carefully, check breathing, listen carefully for no more than 10 seconds. Okay, no more than 10 seconds. First, you have to check for sounds of breathing. So if the patient is occasionally gasping, okay, it does not equate to breathing. So if if the victim is only gasping or not breathing, you have to do CPR. Okay, so now let's move on to the next page. All right, so you have to perform high quality CPR immediately. Why immediately? Because it increases likelihood of survival, and brain damage starts 4 to 6 minutes after cardiac arrest. And it is almost certain after 10 minutes without effective CPR. So when performing CPR, you can think of the acronym CAB. Okay, so remember, CAB. C stands for compressions, A stands for airway, okay, and B stands for breathing. All right, so now let's discuss them one by one. Compressions first. So push hard and push fast. You have to place the heel of your hand. This is the heel of your hand, guys. Okay, on the center of the victim's chest. Okay, so it's here. You just have to feel it. Okay, center of your victim's chest, place the heel of your hand. And other hand on the top of the other. So this is how it looks like. Okay, so use your body weight. Okay, look at me. Use your body weight to help you administer compressions that are at least 2 inches deep. Okay, and delivered at a rate of 100 compressions or 100 pumps per minute. So it has to be straight. Remember, your arms have to be straight. Okay, so that's equal to 30 compressions every 15 to 18 seconds. So 100 compressions per minute. So now let's move on. Okay, so airway. So a while ago, I already told you about this. So tilt head back and lift the chin to open airway. Okay, so place one palm on the forehead and apply firm pressure. So just like what you see in the picture. And then, of course, if you're afraid of getting a disease, you can, again, use breathing barriers. So what are the 2 breathing barriers? 2 breathing barriers. Does anyone remember? Okay, so we have the pocket masks. Yes, Arthur, good job. And what's the other one? Pocket mask, it's good. Okay, so the other one is the bag valve mask. Bag valve mask, okay? All right, so now let's move on to the next one. Okay, of course, B stands for breathing. Okay, so we have to deliver rescue breaths. So with the person's head tilted back slightly and the chin lifted, pinch the nose shut and place your mouth over the person's mouth, okay, to make a complete seal. So this is the mouth of your victim. This is your mouth. So you have to make a complete seal. So blow into the person's mouth to make the chest rise. So while blowing, you also have to observe the chest. Okay? So deliver 2 rescue breaths, then continue compressions. So the ratio will be 30 pumps or 30 compressions, and then 2 breaths until further help arrives. Don't stop, okay? So here, use the AED once it is brought to the scene or available, and continue using CPR and AED until professional help arrives. All right, so now, okay, we are almost done, guys. Thank you for being patient. So to test your knowledge, okay, we are going to have a quiz. It's very easy, all right? So let's start. Well, do you think you guys are ready to save lives? Are you ready to save lives? Mm-hmm. Ready to be a part of Avengers? Okay, great. So I have some questions. Okay, only 5 of them. Let's start. First question, listen carefully. When performing CPR, what is the ratio of chest compressions to rescue breaths? When performing CPR, what is the ratio of chest compressions to rescue breaths? Mm-hmm. Okay, wow. Great job, guys. Okay. Mm-hmm. Oh, Andre, yes, 100 compressions. Great. Okay, but the ratio is 30 compressions and 2 breaths. Okay. So great. Now, next question. When do we stop performing CPR once you have started? When do we stop it? Mm-hmm. So when do we stop performing CPR? So when professional help arrives. Okay. Until help arrives. Good. Good, Merrick. Good job, Ivona. Mm-hmm. Okay. When nurse arrived. Okay, Archer. Good. All right. So now, number 3. What is the purpose of an AED or the automated external defibrillator? So is it to give energy to the victim, to shock the person to wake up, or to restore a normal heart rhythm? What do you think? To shock. Okay. To give shock. That's right. Okay, but there is a main purpose to restore. Mhm. Okay. Okay, different answers. Okay. So, but anyway, it's actually good to give shock. Okay, too. But the purpose is to restore a normal rhythm, to restore a normal heart rate. Good job. That's right. Okay, so let's move on to number 4. Okay, here. Time is critical in starting life-saving measures. How long after the heart stops beating could brain damage start to occur? How long? Do you remember, guys? 10 minutes. Okay. Ivona, 6 minutes? 4 to 6. Okay, yeah. Well, it's 4 to 6 minutes. 4 to 6 minutes. Great job, guys. Okay, so now, okay, last question, guys. Last question. Where do you place your hands for CPR compressions? Where do you place your hands for CPR compressions? Is it on the stomach? Is it on the center of our chest? Is it on the left part, near the heart? Where? On the chest, middle chest. In the center of the chest. Chest, okay. Center of chest. Okay, great job, guys. Wow. Well, I think you guys are already knowledgeable about CPR. But of course, this webinar is not enough yet, okay? So we are only here to help raise awareness about the importance of learning basic life support. And the best way to increase your CPR and first aid skills is to take a first aid and CPR course. All right? Okay, so okay, guys, thank you so much for your participation. Please do me a favor. Okay, I just want you to answer 2 short polls. Okay, so let's start. The first one. Okay, so here. Okay, so how useful was the webinar? So thank you so much, guys, for answering the first poll. Okay. All right. Okay, so everyone finished? All right. Okay. Thank you. And I have another one. Wait, please. Okay. So another poll is here. Would you like to take part in similar events in the future, guys? Okay, thank you. 100%. Okay, great. So guys, please follow us on Facebook and LinkedIn. Okay, so just search for our name. It's Tutlo, of course, Tutlo. And thank you so much for your participation today in our webinar. And thank you for being patient. All right, yes. I'm very grateful too about having you here, guys. All right, thank you so much, guys. And I hope to see you in my next webinar. Bye-bye.